Hello, Balance Mamas, and welcome to the Balance Mama Project Radio. Today we have here Dr. Sai, hey, and we have Dr. Val.
Hello.
And so today we're going to get into a topic that's near and dear to our hearts, and we'll be getting into a little bit of research as well, and just talk about why C-section recovery isn't just rest. So a lot of times when in that early postpartum time period, oftentimes people are told, hey, just rest, especially post C-section, avoid lifting, and then come back in 6 weeks. So don't do anything at all. But what if I told you that research shows early physical therapy can actually help reduce complications and improve recovery and help you feel like yourself again sooner? And so we did do a little bit of a research dive, and then even from some personal experience. Thanks, Dr. Val. We looked at how physical therapy in the hospital or right after C-section isn't just helpful, it can reduce the complications. And so even thinking about, when I think about when folks have back surgery, knee surgery, like knee replacements, spinal fusions, all of these we'll say invasive or intensive procedures, oftentimes people are getting physical therapy almost immediately. Like, okay, let's get up and walking. Let's teach you how to move in the bed. And oftentimes this isn't something, this does not carry over into that postpartum time period, right, Dr. Val?
Yeah, I mean, you're absolutely right. When you think about someone who's had open heart surgery, for example, I mean, they've been split completely open. PT is right there on day zero working with them.
Yes, it's true. And so it is interesting, especially from the women's health lens, that in that postpartum time period, I'm like, a cesarean is a major abdominal surgery. It's important to learn how to get in and out the bed. It's important to learn how to go from sit to stand again and get into walking, because I was like, it can be uncomfortable. Some things might feel or often do feel different. And so when we're looking at it, and more evidence is coming out, but physical therapy services are often underutilized in that early postpartum time period. And so we're going to talk a little bit about what active support looks like in that cesarean time period.
Right, because you need to have active support. It's about active rest, so not just complete do nothing rest. And as we were saying, C-sections are major surgeries, and without guidance, if you're just told just sit down and rest, there's a lot of risk for blood clots and even breathing complications, delayed mobility, meaning that you're not able to, you're kind of holding off on your movement and your mobility, so that impacts how you move when you do decide to move, and increased pain. So I want to take a moment to talk about each of those things that this article is mentioning. So blood clots. If we're not moving, our blood is not circulating as it as it typically would in its most efficient fashion. And that's because your muscles are your body's active blood pump. So your calf muscles, particularly when you're walking and standing, they're able to help pump that blood back up into your heart, which helps your circulatory system. Breathing complications. If you've ever been like sick and in bed for a little bit of time, or I don't know if any of our listeners have ever had COVID, but if you've rested for a long period of time, you know that when you get back up and you start to move around, you might be out of breath. That's not for no reason. So when you have taken a long time to rest, you can start to develop some fluid in your lungs. The cells in your lungs as well can have a hard time opening, getting you a really deep breath.
Oh, the alveoli.
The alveoli, yes, exactly. So
Yes.
all of these things can lead to breathing complications, delayed mobility. You really might have a difficult time with your mobility after you've rested for a long period of time. Your muscles can atrophy or go into a waste kind of
Like a weakened state.
stage. Yeah, a weakened
You get
state.
weaker.
And that happens even within the first 24 to 48 hours of rest,
Laying in bed.
of laying in bed and doing nothing, right? And so we are really talking about some significant impacts of the complete and total rest. And then increased pain. So again, if you are not moving your joints in your body, your joints, they work well with lubrication. And that means that you are moving some fluid through your body. If you are in a state where you're resting for a long period of time, let's even say that your legs are lower than your heart, you are at risk of having increased inflammation or fluid buildup that can create some pain as well. So we can go into that for days and days, but these are just some examples of what can happen when we just take pure and straight rest for 6 weeks, as we are often recommended post C-section or even post vaginal delivery.
I almost want to comment because I don't want people to be afraid of rest.
Yeah.
And I know we'll talk about active rest and movement as well, but it really is that immobility.
Yeah.
So when we're saying rest, like think immobility, like I'm going to lay in the bed. Yeah. I'm not going to get up. I'm going to be curled up on my side. And even to your point of pain, when we talk about tissue healing, like or scar tissue remodeling, so cesarean scars, like they need feedback to know, like, oh, okay, this is the way I'm supposed to move, this is the way that I'm supposed to heal. So we usually do need some extra feedback. But I love your breakdown. And it's like, yes, you get weaker, yeah, movement's not going to feel the same. Yes, even in postpartum, you're already at increased risk for clotting just with that extra blood flow, with the hormones trying to re-regulate.
Yes.
Same thing for pregnancy.
And we are very big proponents of knowing when to rest and knowing when to move. And that's something that we often support our clients on. And everything is a balance. And we like to say that balance doesn't mean that you're doing equal and even things, but you know when your body needs to prioritize resting and laying down for a moment just to kind of let the body reset for your nervous system. And then you know when you need to kind of get up and moving and have some active support, as we're discussing here.
I was going to say, I know we ran through some of the common concerns that come up, but also as PTs, I know there's some other common issues when we get into the musculoskeletal system. So looking at muscles, looking at joints, bones, and how people are moving. Can you tell us a little bit more about what are some of those common issues?
Yeah, absolutely. So some of the common issues we see are like your weakness in the core, and your abs are not able to activate. And we're not just talking about those six-pack showy ab muscles, but we're talking about all the muscles that go into the core. There can also be scar adhesion. So when we talk about that, where the incision was made, and now it doesn't have to be a huge incision as it once was. It's very small, probably like 6 inches or so.
Yeah, they're really little and low.
Yeah. At the same time, it still has been a cut to the system. And so there's scarring that happens because your body builds up tissues to support you. What we do as PTs is help to decrease those adhesions so that your skin and your muscles and your fascia are all able to move properly and glide on each other well, so that you can activate your muscles properly.
We don't want sticky tissues, so we definitely talk about scar massage, timing, and how to do it yourself.
Absolutely. There's also pelvic floor dysfunction. So even without having a vaginal birth, a lot of times we think about pelvic floor dysfunction, pelvic pain with intercourse, incontinence, things like that. A lot of times we think about that only related to a vaginal delivery, but that's not true, because with any pregnancy, you have held this baby, this growing baby in your body for over 9 months. And so your pelvic floor is doing a lot of work to hammock and hold up all of this additional weight. And so with that, there can be some pelvic floor dysfunction. There can be some lower back and hip and pelvic pain as well. Again, as your body started to adjust to baby, and then immediately postpartum, your body then has to do another adjustment. That might mean that your walking is a little bit different, your sitting is a little bit different, your standing is a little bit different. And not to mention that because of all the hormonal shifts, your ligaments are functioning in a different way. They've been lax, they've been loose for a long period of time. And so you have to relearn how to stabilize and support your body as well.
Can I make a quick interjection?
Get in here. Yeah.
I was going to say, I always tell my folks when they come in that holding together the pelvis is a group project. So like core muscles, back muscles, hip muscles, and the pelvic floor are working together to give stability to that base part of the body. So if one area isn't working as well, then another area starts to pick up. So on top of the stress of baby sitting or putting extra weight on that pelvic floor, now we're talking about the core not activating. Like you had mentioned, the core not activating as well. So what is going to pick up the slack? That's why when the core, so those abdominal muscles aren't kicking on, yeah, they're helping to stabilize the spine. Yes, they're helping to stabilize the pelvis. So when they don't do that, the back might hurt. It's doing more than it should. The pelvic floor is like, oh, what's going on? I'm just trying to hold in your urinary stool. Now you're making me work hard to stabilize that pelvis from the bottom. And so it's always like a dance of making sure everyone knows or like is coordinated, knowing when they should kick on and remembering how to kick on. Like the belly was stretched out for quite some time. And so now it's like, well, how do I function with my new muscle and tension relationship?
And speaking of the belly being stretched out for quite some time, you also might have some ab separation, which now is widely known even in the non-clinical space as diastasis recti. So that's the separation of the abs. Your abs have been stretched out no matter if you're having a C-section or a vaginal delivery. That is by nature what happens when you're pregnant. And for some individuals, especially if depending on your own anatomy and the baby's anatomy, you might have had some separation in your abs, again, regardless of if you have had a vaginal birth or not. And so those are some of the common issues. And I will say that it's important to know the right kind of movement and support to be able to heal well. So when we talk about early movement, Dr. Say, what are some of the things that are just kind of really critical?
Yes, getting out of the bed early. I know on any given day, I do like a good lounge in the bed. Like, I'm going to stay there. But when we talk about that immediate postpartum time period, yes, I'm sure the body is exhausted because we've been pushing, moving. Or if you went straight into the cesarean, it's still exhausting to have a major abdominal surgery and then get up and somebody's like, so you want to get out the bed? Probably not. But even in that first 4 hours, 6 hours, 8 hours, that's a great time. Like, do we want to safely move? Absolutely. That's why for some of my mamas, I will go through, even in the prenatal time period, okay, if no one else tells you, this is how you're going to get in and out of the bed. We need you to roll like this. We need you to push here. This is what we can do to make sitting, like going from sit to stand, easier. A lot of these things sound very basic, but when it's like, oh, no, my abs aren't feeling like they're kicking on. Oh, no, this is tender and sore. I'm a little bit more hesitant to move. It's helpful to kind of know those tasks preemptively. And if nobody's coached you, even asking before birthday for tiny one, hey, do you all have physical and occupational therapy services available? If you're in the hospital setting, if you're in the birthing center setting, if you are at home, consider even linking up with a therapist to kind of go over, okay, well, how do I want to move? And so if you're at home, we're not talking about cesarean at that point. Same thing for the birthing center typically. But even for vaginal births, I know that is not our topic for today, that early mobility is going to be important. Like we want to get the muscles re-engaged. Circling back to cesarean, making sure you're taking time to walk around, get that blood flow and circulation that Val talked about, Dr. Val talked about. It's so important. I'm like, even walking becomes a form of exercise and strength training for the body. We're getting used to loading the body. And that nice, tall, upright position is going to help stretch out. A lot of times, if an area is painful, our natural reaction is to curl in, which in essence, it might feel a little bit better at the time. But when you go to move, then it'll feel more sticky or more painful because it's like, oh, I'm scared to move that way. Oh, it feels painful. But you getting up and walking is going to start giving that tissue feedback and reminding it like, yeah, you can move. Yeah, you can do this. Like even laying flat in bed. is going to be a helpful thing. Might not be the most comfortable early, but really giving those tissues a moment to stretch out and gently moving. So if you're like, I'm nervous about getting up to walk, maybe even beginning some heel slides or getting some type of gentle movement in the bed, because it can be scary.
It can be scary. To that point, can I make a little neuro moment?
Neuro note. Come on, neuro specialist. We're here for it.
So the thing is, your brain is always going to want to protect your body and make sure that you are staying safe. And so with any type of insult to the body, be it a scar or an incision, the brain registers that as a tiny threat. So that is why your brain says, okay, I need to protect that area. It has been affected, so I need to protect that area. So that's why your body automatically goes into this curled position to protect your abdominal area. Then what happens from there is your brain starts to register like, hey, I can take some breaths in this position, and I can just take these shallow breaths, and it's okay. Think about it. Your whole entire rib cage, your lungs are in this curled and protective position, and you're not exactly getting a deep breath, but your brain is like, it's cool, I got it. When you do decide you want to sit upright and expand your body, if it's been a long period of time since you've done that, your brain will be like, whoa, danger, alert, hold on. It will register. That's how my brain says. Whoa. And so your brain is gonna say, wait a minute, that doesn't feel good to me. And it's gonna be difficult actually to take a deep breath. It's gonna feel like almost restrictive to take a deep breath, but your body needs that to be able to move well. So anyway, quick neuro note on like just how the brain wants to protect you so badly.
I love the neuro note. I see. Yes, we got to hear from the neuro specialty and what the brain is saying. So when we talk, and I'm glad you even mentioned the breathing. Breathing is an exercise. Yes. I know it's like, okay, I'm breathing each day, but intentional deep breathing, learning how to breathe into the rib cage, because a lot of times people get shallow breathing during the pregnancy. The baby's taking up a lot of lung space. Walking's helping us with that circulation. Pelvic floor exercises. The muscles have been stretched out either way. So starting to regain awareness of what that feels like. Those are all early things that can be done. And so when we talk about incorporating some of this early movement, I'm just going to remind you, lower complication rates. You might have a shorter stay at the hospital. If you don't have to stay there longer, it's typically going to be better in reducing the likelihood of having a physical decline. So when we looked at the literature, a lot of times that early mobility is helping to reduce pain and make walking easier in the long run, even on day one. And so I said in the long run, on day one. But in looking at even day two, people with that rehab approach notice easier turning in bed, easier transition into getting into sitting, easier passing of gas. And y'all know the gas pains will tear people up.
I'm telling you.
I had a mentor go to the hospital for an emergency and it was just bad gas. And so like, if anything, a lot of times with the medications, sedation, things like that, the colon, the bowels might move a little bit slower. So we want our intestines and everything to keep it moving. We want to be able to pass gas. We want to be able to get the poops out without it being especially painful, without it being especially difficult. And a lot of times when people are even coming in for constipation without a cesarean, early movement is going to be one of the key things, of course, and hydration. And so even with that, when you think about less pain, that means less pain medicine. That means less things hindering you from moving the bowels. And so all of these things are things to consider when it's like, oh, this feels scary. Reminding yourself like, no, early movement can be safe. We want to have some guidance. I don't want you to just get out there and jump out the bed. Please have some guidance on what log rolling looks like, on how to breathe and when to breathe, because a lot of times people hold their breath to avoid pain or hold their breath to do hard things, when in reality, like, we need to breathe to do the heavy lift. We need to breathe, or I should say breathe out to do the sit to stand. Like just knowing and reminding yourself, like, yes, I can take things slow, but also I need to be intentional about my breathing. I still need to move even if I'm moving slowly.
Absolutely. Absolutely. Slow does not mean that you are not getting some really key feedback into the brain, that you're not strengthening. Actually, slow is better sometimes. But, you know, I want to emphasize that physical therapists, and we're just going to get on a soapbox for just a second.
We here.
We play a really frontline role. And especially our PTs in acute care. Shout out to our acute care PTs.
Yes, they're built different.
They are built different. When I say essential, okay, these are essential human beings because they're the ones who are going to help make sure that you are moving safely. They're going to be the ones, to Dr. Say's point, who are going to look and say, oh, remember to breathe. Oh, remember that it might be an easier time if you push up in this way as you're going out of the bed. They're going to look at your walking and say, hey, maybe widen your stance, or maybe let's bring your feet in closer and help you to move in a safe way after surgery, after a C-section. Also, they're going to teach those breathing exercises. It might be that you would benefit from a breathing device that helps you get a deeper breath. It might be that you need that, the inspirometer. Exactly. Yes. It might be that a PT is going to be able to assess and note that. Also, a PT is going to be able to help you protect your core. So a lot of times I will see a client, maybe postpartum, but maybe like a few months postpartum, and they're lying on the table, and I'm like, okay, let's hop up and do this exercise. The first thing they do is go from directly laying flat to sitting right up, popping right out of bed.
Sit up.
And I'm like, you just did a whole sit up with your legs straight, and you had abdominal surgery. Like, whoa.
And it's like, that hurt. I know it did.
My back hurts. I know. I'm sure. It does. So from day zero, PTs can make sure that you are protecting your core. And remember, as Dr. Saya was saying, your core is not just the front. It's the back. It's the side. It's the bottom part. It's all of it. And then finally, education is going to be key. So how do you move without pain? How do you move in a way that your brain is not going to register as a threat? PTs are the ones who are going to help with that. And so it's not just for, a lot of times people think like, oh, PTs is just for if I hurt my shoulder, if I hurt myself. But no, PTs are a part of the surgical recovery team. Now, if you don't leave here with anything else, remember that we are a part of the surgical recovery team. I will never forget, though, during the pandemic, I was working in a hospital-based outpatient clinic, and they were like, no, you guys still have to come in. And I was like, wait a minute now.
So PT doesn't want to come in.
And they were like, no, you are essential. And I was like, I'm a part of the essential workers. Like, are you sure?
I was too, girl. And I was sad.
I was so sad. But then I think about it now. I'm like, I guess you're right.
PTs are essential.
Yes. And the pandemic taught us a whole bunch of things. And really made things kind of worse in terms of healthcare, I think.
I will say more challenging in some ways. I do like there's more virtual care. Ooh. I will never lie on that one.
Yes,
there's a lot
that's
that
true.
Can be done
More
in the
access.
virtual space. More access.
Yeah.
Yes, because we found new ways to do access.
That's true.
However, I think the isolation space where it's like we're only doing, and when we say yes, we are necessary, when it's like we're only doing what's necessary, like people's partners can't come to the birth.
Yeah.
People's support people can't come to the birth. And so you can imagine, no, they were not like, you were in a hospital-based outpatient. In the acute care setting, it's not like, oh, we're going to have PT come help you. No, if you're not the immediate staff getting this baby from in the womb to out in the world, no. And so I think that we might or may have lost some gains in care when it comes to realizing that PT is still essential in that early acute space, like in day 0, in day 1, day 2, in that postpartum time period. Even though it's crazy because I'm like, for knee replacement, I can't stop with the knee replacement. Hip replacements, you're still going to pretty much automatically get a PT consult to get up and moving and safely moving. But I don't think the same standards are always applied. And so in the COVID situation, I think that was not helpful for growth in this like critical window, that early postpartum. And so even with that, so yes, we say PT wasn't there, but I'm sure lactation consultants were probably not on the high totem pole.
Sparse.
And so a lot of moms did get sent home
Yeah,
without the support.
OTs.
Yes, OTs, making sure you feel comfortable in your feeding positions. And so I think we're still seeing some of those ripple effects where it's like, oh, we didn't need it during COVID.
Right.
And it's like, you did the bare minimum and people did struggle, but it doesn't mean that we can still do the bare minimum and let people struggle, especially when there's access to, yes, occupational therapy, physical therapy, lactation consultants inside and outside of the hospital. It should still be a team approach in that regard.
Yeah, yeah. And I think with that, then, we're still playing catch up on the education piece. We're still playing catch up on reminding people of the importance of these allied health professionals stepping in to support moms. And so then with that, I think we also see that there's care that really kind of widely varies based on which hospital you're going to, which provider you're seeing, and the types of access that you have. Do you have access to virtual care or no? Do you need to go in to see someone, and how often can you get an appointment? And when you see that person, what are their credentials? What is it that you are looking for in a provider?
Yeah.
And so, because the care varies a little bit more, now some women might not get the support that they are looking for, and that we are the first to acknowledge that is unfortunate. And many don't get the support that they might be seeking. And so we strongly believe that recovery should not depend on luck. You just being able to, access,
show up and get whatever's there.
Show up and exactly. So we want our listeners right now to walk away with some concrete questions that you can ask a postpartum rehab provider so that you know that you are in good hands.
Oh. I definitely think the questions, at least the questions that we had chatted about, would be helpful when we talk about outpatient standpoint.
Yeah.
In that acute care, I'm like, find the rehab provider on the unit.
Rehab provider on the unit. Yeah, to be very clear.
Yes.
In the acute care setting, so day zero, we're talking about day zero.
If you're in the hospital.
Any acute care rehab provider, a PT on the maternity ward is going to be able to move you well, help you decrease pain, all of the things that we mentioned earlier today.
Yes.
Typically.
At baseline, yes.
At baseline. So these questions are questions that you're going to ask for that 0 to 6 weeks even, immediately postpartum. So remember, we're talking about your post C-section and you've been told, don't do anything for 6 weeks. We're
you
saying,
gotta lift your baby,
right?
And that car seat still looking at you, looking at
you. You still
gotta
lift the car seat, lift the stroller, lift the
you
baby.
gotta get on the floor.
You might have stairs to climb. Okay, there's a lot of things that you gotta navigate, and you're told not to move. So we're talking about these questions are questions that you're gonna ask a postpartum rehab provider when you're in that 0 to 6 weeks. Because remember, we're gonna set it up ahead of time, right?
Yes, please start early. Even pelvic PT, they'll be booked months out.
Yeah, seriously. So things you're going to ask, right? Write it down. How often do you treat women with my condition or my concerns?
Yes.
Right? Number 2, what is the expected course of treatment for my condition or my concern? You have every right to know.
How long is it going to take? What does it look like?
Yes.
What might be included? If the plan changes, okay, but at least having an idea of what start to finish looks like.
Correct. What options for care are presented in the research based on your knowledge?
Yes, evidence-based.
Evidence-based is key. Any provider should be able to justify what they are doing based on their research and based on their knowledge. Absolutely. And then, like Dr. Say was saying, what is my expected duration of care? How long am I going to be here? Yes. Yeah, absolutely. So all of those questions are ones that you are going to want to follow up with your provider on, just so that you feel cared for and seen and supported in a very structured and effective way.
Yes. I like the questions. Feel free to rewind, pause between and write them down just so you can know that you're getting the best care. And so just to sum it up, when we're talking about early, like the first few things to consider when we're in that early C-section space or early cesarean space, start gentle movement as soon as possible with guidance. So yes, we want you to get your good nap in, but once it's time, like 4 hours, 6 hours, 8 hours after, we should be able to do some gentle movement, whether that's walking, whether that's, and so movement, everything counts. Rolling in the bed counts.
Yes.
Going from laying down to sitting counts.
Sitting up unsupported
Counts. And so learn, of course, how to get out of the bed safely. We don't want the straight sit up. Do not do the sit up. The core is still trying to recover. And then reconnecting with your breath and with the core. No, not crunches. We know people love the crunches, and the V-ups have been taking me out. But learn how to gently engage the core. So even in some of our master classes, we talk about breathing and gently engaging the deepest layer of the core. And you can even use that with your functional movement. Not like you have to have a whole exercise program to start on, but even working the different muscles as you complete your functions. So start the gentle movement. Learn how to get in and out of bed. Reconnect with your breathing and with your core activation.
Absolutely. And just remember that you can be completely cleared at 6 weeks. Someone can tell you you're good to go, you can do all the things now, but you can also at that same time still not feel as strong as you'd like, or as stable, or even just feel like yourself.
And probably won't.
Let me just,
I haven't seen it yet.
Let's like level set and expectation set here. You probably won't.
Unlikely that you're going to feel like yourself at that point.
And it doesn't mean that anything is wrong with you. So we just have to be very clear that is, people expect to feel a certain way, and it's likely that you will still be recovering at 6 weeks. And know that it's okay.
Yes.
You are just looking for some support. And that is where PT comes in. That's where OT comes in. That's where lactation specialists, postpartum doulas, that's where your team comes in to help support you.
Absolutely. Because I was like, you'll need a team even beyond the 6 weeks. And sometimes 6 weeks is surviving.
Hello.
And then you tap into your team.
We just trying to get there. And so with that, we hope that you have taken some nuggets. Stay balanced, mamas, and we will see you next time.